I love it. I can tell you that the amount of people that I've gotten to help, the number of women who have children now who were suffering from infertility, the women who were telling me that they couldn't walk out in public because they would flood themselves, and who are now living normal lives. Every patient that comes back and tells me that, that's the reason why I do this. So I hold two sides to that issue. My first side is that I think it's exciting that there's an opportunity to help people that might otherwise not be able to have a child, and that I think that it's an incredible advancement in our technology and a statement of what our technology is. The flip side is I have a bit of an ethical dilemma with this, because we are taking women and we're going to expose them to something which could be life-threatening. And while being on the front lines and dealing with people with infertility issues and constantly dealing with this, I understand how difficult it is. But the idea to say that I'm going to risk someone's life, I'm going to put them at potential lifelong danger because of the fact that they're going to be on anti-rejection meds, that it increases the risk of lymphomas, of infections, for the sake of being able that someone else's uterus in you will gestate a fetus, I haven't myself worked out my complete feelings on it, but I do find that there is an ethical dilemma there. If we look at transplant history in general, the first bunch of them usually fail. Mm-hmm. If we look at historically, transplanting other solid organs and such. From a transplant perspective, again, and I'm not a transplant surgeon, what it comes down to more so is the ability to harvest the vessels far enough out, and then the ability to reconnect them. So is it that much more difficult? Probably not. It's the reason why I think that they've started doing it. The difficulty lies in, again, I think, in the idea that this is, as opposed to a liver where we're treating a specific disease or a kidney, here we're doing it for an elective purpose. Well, I think a lot of it is unlocking some of the secrets as to what is actually causing them. I think that if we can get into the basic molecular understanding of it a little bit better, then we may be able to create better drug targets. And to be able to potentially treat it medically without any surgical options. And even if we can't completely treat them via drug option, the ability to do better localization of the fibroids themselves and treat them at an earlier stage before they become symptomatic for a patient.